Hi everybody, Dr. Garcia from Garcia Facial Plastic Surgery. Today I'm going to be discussing your post-surgical instructions with regards to facelift surgery. Facelift is one of the most commonly performed procedures here at Garcia Facial Plastic Surgery, and it's important that you adhere to all of our instructions. The first thing is what happens the night of your procedure. You're going to have a dressing around your head that is going to put pressure on the sides of your head for the first few hours after this operation. You can use cold compresses on the exposed areas to help cut down with the bruising and swelling, and you can continue to use these cold compresses after the dressing comes off the day after the procedure. Now, the incisions are the most important part here. There is going to be an incision along the side of your face here, and that incision is inside the hairline here, behind the ear cartilage, around the earlobe, and then in the crease of the ear, and then into the hairline. All right, so there's different things to do with this incision. Within the hair-bearing areas, that is this front part here and the hair-bearing area in the back, we ask that you clean with a Q-tip with hydrogen peroxide. You take the Q-tip, you put it in the hydrogen peroxide, and then you clean like this here and like this here 6 times a day. That is all you need to do in the hair-bearing areas here. If this incision along the crease of the ear here and along the back of the ear is present, you're going to do the same thing with peroxide. You're going to clean with the Q-tip with peroxide along this incision here, the incision along the back of the ear, never pulling the ear forward, always keeping the ear back, clean along these incisions. But in addition, you're going to use the antibiotic ointment. And that antibiotic ointment can be Neosporin, it can be bacitracin, it can be whatever you want, but you're going to apply that antibiotic ointment only in front of the ear and only behind the ear. So once again, clean the entire incision 6 times a day with hydrogen peroxide, but only use ointment directly in front and directly behind the ear. You are also going to have an incision behind your chin. This incision will be hidden in the crease here. This incision typically will have a piece of tape on it, and there's nothing for you to do. Should the tapes fall off, you're going to follow the same schedule as you did with the other incision, which is clean with peroxide 6 times a day here, and then apply a little bit of antibiotic ointment here. That is only if the tapes fall off. If the tapes do not fall off, leave them alone. We will take them off 7 days after surgery. In addition to that, we're going to ask you on the day after surgery to rinse your hair with warm water. When you get home after that dressing has been taken off, we ask that you rinse your hair in the shower with warm water. That's going to help get the dried blood out of your hair, and it's going to help in terms of hygiene. You only wash with water the first day. Starting the second day, you're going to start washing with baby shampoo. We want you to wash your hair with baby shampoo twice a day, starting the second day after surgery. In addition to that, we're going to ask you to wash your face with Cetaphil soap. This one here happens to be the liquid. You can use the bar. It doesn't matter, but we want you to wash your face 3 times a day using the balls of your fingers along the entire face with Cetaphil soap in the first 7 days after you're recovering from facelift surgery. There are going to be some additional instructions like keeping your head elevated for 2 weeks, dietary restrictions that we're going to give you, but these are the basic instructions on the first few days after your facelift operation. Thank you for watching.